There's been much debate about the anti-malarial drug hydroxychloroquine. President Trump said he was taking it, but says he's now stopped. He still calls it tremendous. There is evidence, though, it's not. Research published in the Lancet showed an increased risk of death, and the World Health Organization has temporarily halted trials to determine if it's a safe and effective treatment for COVID-19. Canada was taking part in that trial. Heather Urix-West explains why it's been suspended.
There are concerns that hydroxychloroquine may be doing COVID-19 patients more harm than good.
The executive group has implemented a temporary pause of the hydroxychloroquine arm within the Solidarity trial while the safety data is reviewed.
35 countries, including Canada, had been recruiting patients for the trial at 30 hospitals across the country, although no Canadian trial participants had been given the anti-malaria medication yet.
Mostly it's related to some emerging evidence, not from randomized controlled trials, which are the gold standard, but from observational studies, suggesting that there may be some harm associated with hydroxychloroquine use in hospitalized patients with COVID-19 infection.
That evidence was published last week in the Lancet. It found that after reviewing 96,000 virus patients across 6 continents, there was a higher risk of abnormal heartbeats that could cause heart attacks among those treated with hydroxychloroquine.
The problem with this analysis in the observational study in the Lancet is that without randomizing patients to hydroxychloroquine or no hydroxychloroquine, the assumption is that sicker patients will likely get more medications, and it's impossible to control for that.
A trial safety committee will now review all of the data that has been collected within the randomized control trial so far to determine whether hydroxychloroquine has been causing harm. That review is expected to take 2 weeks.
If there's no harm, then we'll continue, because there still might possibly be benefit associated with its use.
A second Canadian trial out of the University of Calgary has also been suspended, pending further review. Heather Urix-West, Global News, Calgary.